Okay, so I've already reviewed the physician's orders, and the physicians have ordered me to remove the prior packing and the dressing from the wound, assess the wound, cleans the wound with normal saline, repack the wound with normal saline soaked gauze, and then bandage the wound back up with an abdominal pack. So now that I've reviewed the physician's orders, I'm going to wash my hands, bring supplies to the bedside. Once I get to the bedside, I'm going to knock on the door, perform hand hygiene as I walk in, and say, "Hi, my name is T.Prazak. I'm going to be your student nurse today. This procedure we're going to be doing today, I'm going to be unpacking your wound, cleaning it, assessing it, and then repacking it and covering it back up again. I'll be cleaning it with normal saline and repacking it with some gauze. Would you like any analgesics for the procedure?" They say no. So I'm just going to ask them their name, and she says her name is Lucy Marigamo. And I'm just going to confirm here that this is Lucy Marigamo and this is Lucy Marigamo. So this is the correct patient. So now I can go ahead and raise the bed to a good working height. Perfect. Okay. So now I can wash my hands. I'm just going to uncover the dressing here, or at least expose the leg. Just rotate the leg to the outside here so the normal saline drips onto the pad. So now I can wash my hands and put on some clean gloves. So now I'm just going to expose the wound here, and as I do so, I'm just going to assess the old packing gauze in the abdominal pack, and I see that it's stained with serosangreous fluid. It's about 30% stained. It's normal. I don't notice any foul odors coming off the wound or the abdominal pack. There's no signs of infection, but I'm going to reassess the wound later after I clean it. So now I can just close this. Take my gloves off. Just gonna clean my hands and then prepare my sterile field here. Just over here. Just gonna put the abdominal pack on the bed.
Maybe just like lower it, just like.
Okay, so if that would happen, I would just restart and grab another kit, restart the process with the sterile kit, and do the same thing. So I'm just going to pretend that I'm there. So I restarted. When I uncovered this, I grabbed the forceps. They're still sterile. So now I'm just going to grab this, and I'm going to use this to extend my field here. It's not sterile, but I'm just going to use it to just protect the bed here. Actually, this should be okay. Alright, so next. I'm not going to be using this garbage. I do not plan to be using these forceps.
For my excuse, it's brand new. So
and now I can start adding things to the sterile field.
I don't know.
So I see that the normal saline here is not expired, so it's still safe to use. And when I add this to the field, I'm going to be mindful not to drip any on the sterile field. Perfect. Now I can just this. Next, I'm going to add some sterile packing gauze. Perfect. I'm going to add a 13 milliliter or 30 milliliter syringe. Next, I'm going to add a 20 gauge Cathlon catheter. Perfect, dispose of this. And lastly, some cotton tip applicators.
Oh yeah, I know. Every time you like.
Perfect. Okay, so now I'm just going to slide my sterile flip over just a little bit. And go ahead and don my sterile gloves. So I'm going to perform hand hygiene. Here. I'm actually just going to readjust this again. Just to make some more room. Perfect. Okay. All right, so I'm going to perform hand hygiene. So I'm being mindful not to touch the gloves to my skin, or at least the outside of the gloves. All right. Perfect, so now I can just dispose of this. Making sure not to drop my hands below my waist. If I do, then I would just restart the process with new sterile gloves. So now I'm just going to draw up around 25 milliliters of normal saline.
Get in there realizing that I don't have the
cap on.
yeah, right at the end. Now I'll take my sterile thing off.
Perfect. And now I'm just going to get the Cathlon catheter ready. I'm going to be mindful to dispose of this in the sharps once I'm done the procedure. Perfect. Now I can go ahead and begin to irrigate the wound here. So I'm going to be doing this at a constant pressure from about 5 to 10 centimeters away from the wound. I'm making sure that I do this until the normal saline runs clear, which it has. So now I can just dispose of this. Making sure not to drop my hands below my waist. And now I'm just going to grab some 2x2s and clean the peri-wound skin. So I'm just going to soak this in normal saline. Go once around the outside here, drop. Two. Perfect. And now I can go ahead and dry the peri-wound skin. Just on the outside there, drop. Making sure not to touch my gloves to the skin.
The number 1, 2, 3, 4, 5, 6,
Perfect.
7, 8, 9, February 6,
Okay, so now I can
7,
assess the wound.
admitted for
And I just noticed here that again, there's no foul odor coming off of the wound. There's no signs of infection around the peri-wound skin or in the wound itself. There's some granulated tissue forming which is a good healthy sign of tissue growth, so the wound is healing. So now I'm just going to prod around the perimeter of the wound to check for any undermining or tunneling, and there isn't. And now I'm just going to make sure not to reach directly over my sterile field and just get the dimensions of the wound. So I see here that the length is approximately 9 centimeters. The width is approximately 4 centimeters, and the depth is around 2 centimeters.
This is double signed. Make sure.
So I'm going to be mindful of that. I'm going to be documenting the dimensions of the wound later. So now I can begin to pack the wound. So I'm just going to grab the packing gauze,
Good, we have the right climb. So today I'm just going to
soak it in the normal saline,
Before that, do you have any allergies? If you don't have any allergies. Today
and
I'm
just
Foley catheter.
squeeze it out a little bit.
Acute kidney injury. So it was just to drain out your urine, measure it ins and out.
And now I can
Okay, you're okay with
begin
it?
to pack
So that's good. Now,
the wound. I'm making sure that I don't
what our supplies
pack the wound too tightly, but that I am filling all of the spaces here. So all the spaces in the wound have been filled, and it's not packed too tightly. So now I can cover this up with
and I will attach,
a 4x4.
I'll secure this to the bed. Put the bed to the bed to a part that doesn't move.
Perfect. And now I don't need to remain sterile anymore. And I'm just going to cover this up with a abdominal pack. I'm just going to rotate patient's leg back. I don't need to remain sterile anymore, so there's no problem with that. And now I'm just going to tape up the corners of the abdominal pad. So now I'm just going to explain to the patient while I'm doing this that we'll be continuing to repack, clean, and assess their wound twice a day, and as necessary moving forward. I'm going to be mindful. I'm going to note how the patient tolerated the procedure. They tolerated it very well. I'm going to be documenting that, as well as the state of the wound, how it's healing, and the dimensions.
And since it's female, we
And
have the
perfect.
full French catheter.
So I'm just going to document those things. Be mindful to document those things I mentioned prior. There's no foul odor. There's some granulated tissue forming, so that's good signs of healing. Just going to document the dimensions again, how the patient tolerated the procedure. I'm going to lower the patient's bed, take off my sterile gloves, clean my hands, make sure the patient has a call bell in reach, and that's it.